All right, you're all set.
And just going to go ahead, pre-slide theories. We're going to talk about several theories tonight. Uh, Positive psychology all the way to social cognitive theory. And we're going to talk about motivational interviewing and really tying them into health coaching and how they relate to all that. I'm going to start you all off with a quick question. Which factor do you think most influences the way humans behave? And they got, what are our own capabilities? What's our gender? Race, culture, awareness, attitude. Does anybody care to?
I would say the intersectionality of all of those influence how we behave. But if I had to pick one, I would say awareness.
See? And I always say, Kimberly, your first guess, the intersectionality of all of them, is really the right answer because there's no wrong answer on any of those. It's depending on the person. You know, any one of these, any one of those elements, any one of those items listed can have more or less imprint on the way a person behaves. And that's both inside and outside of their scope of health. So that intersection, I like that, the way you phrase that, the intersectionality of all of them. Yeah, really have the impact on the way we behave as humans. We're going to do a quick review on, what drives our behavior, our health behaviors, and what drives change. And, we got a theory for that. The trans-theoretical model of change. And it's a pretty handy theory. And I always like to point out, this is to inform us of coaches, because part of coaching is to meet that client where they're at. This model really helps inform us as coaches on where best to meet that client and deciding where they're at. And the other thing, you can enter or exit this trans-theoretical model at any stage in it. It's cyclic in process. It's not straight linear. Somebody doesn't always start at A and go straight to C, and there may be changes throughout it. But what else do we remember about the trans-theoretical model of change? Real brief, pre-contemplation. What's that? What's a real brief definition of pre-contemplation?
Not even close to thinking or considering about the behavior change.
Not even thinking about it. Not likely to make any change. And the book says not likely to make any change in 6 months. Doesn't see the benefits or the cons to changing. Pre-contemplation, not thinking. That's before thinking. And then contemplation, we got that stage, they're starting to think about it. Maybe they still got a little bit of ambivalence, but they're starting to weigh the pros and cons of both changing and not changing, and thinking about it as they go forward. And then, we got that determination or preparation stage, and that's pretty much right in there. They're getting ready to make changes. They're prepared to. Did thinking about it, and now they're going to put the plan into which is the next, that action. And that action stage is actually taking those active steps to make that change. Somebody's plan might to be increase their physical activity in 6 months to meet the CDC guidelines, and their first step, the first action they take is just to research gyms within a reasonable commute. So we have that. And then you got the relapse or recycle, and that can happen at any time in this stage. And I like to say, Mike Tyson in the 90s said everybody has a plan until they get punched in the face. Well, life will punch you in the face. You could have this beautiful plan, you lose your job, maybe something happens, something changes, maybe a relationship status changes. It could be as simple as the clients, maybe their child graduated high school and moving away to college. Things can happen that change, and people will jump back into various stages and various areas in this trans-theoretical model. Hitting the right button here. And I've said this before, health and wellness coaching, it, it's a relatively young profession, but its strategies and techniques used they're fact-based, evidence-based. And essentially that just means, what we do as coaches is backed by theory, derived, research-based information. And for us as coaches, and it's a very client-centric approach, it's important for us to understand the how health coaching relates in this theoretical framework and how that influences the development and people's progress towards change. And these theories that we use for coaches, I think they're really used as a frame of reference for our understanding. They're not used for us to put labels on people necessarily, because we don't diagnose, and we're a non-judgmental approach, but they help inform our practice and the way we work with the clients that we're seeing. And the other cool thing about this is that right out there, it's a relatively young field. I think the national board exam has been offered since 2016. That's 8 years. Everybody in this room we're pioneers in this field. We're defining what it's going to look like as we go forward. So that's pretty cool. Pretty cool when we think about that. And then before we get into a real heavy, the didactic portion and we dive into the theories, and we're going to start with positive psychology, I just like to invite everybody, and it's always an invitation, just to join me in a little bit of a mindful moment. And what I invite everybody to do is we're just going to do a technique that I learned from Heart Math. It's just called a quick coherence technique. And it's going to involve a little breathing, a little thought on your part. But the cool thing about these quick coherence technique and those various techniques is that it doesn't require a lot of that specific place your feet flat on the floor, everything like that. It's just really a technique if you practice and perfect it. I like to say you can do it when the bear's chasing you. You can do it when you safely get up the tree and you're away from the bear. And you can even do it after you get down from the tree, the bear's gone, and you just want to decompress a little bit. But it just goes a little bit like this. I just invite everybody to, breathe a little slower and deeper than you normally breathe. Maybe inhale for a count of 5 and exhale for a count of 5, or whatever rhythm you find comfortable. And as you're continuing to breathe slower and deeper than you normally breathe, picture your breath, see your breath flowing into the chest, into the heart. Breathing a little slower, a little deeper than you normally breathe. Seeing the breath flow into the chest, into the heart. Now, as you continue this slower, deeper, heart-focused breathing, I just invite you to pick up a regenerative feeling. It can be a feeling of love, a feeling of compassion. It can be a feeling of accomplishment. It can be for a special place, a special event in your life. It can even be for a pet. And now I invite you to hold on to that regenerative feeling as you continue to breathe slower and deeper, seeing the breath flow into your chest, into your heart. We're just going to go ahead, do a couple, 3 more iterations of this heart focused breathing. And when you're ready, if you could let me know by simply popping your camera on or dropping it in the chat, ready to move on. Yeah. All right. And just like when we do those grounding centerings and a coaching, I just, someone, if you're willing to speak into the room, just briefly share, how was that?
Felt really felt really good. I clinged on to just a good experience of just hanging out with my wife the other day. It brought me back to that. It was a real peaceful
You,
moment and just fun. And it just felt really good.
you
Yeah.
found some benefit in reliving a recent experience.
Yeah.
Anybody else?
I wouldn't say a recent experience. I would just say it's the first time of the day that I've actually took time for myself to breathe and just to be.
And Brock, the first time today, it's 6:19 my time, that you've taken time for yourself to breathe, to be.
Yeah.
Yeah. Life is busy.
Well, I think we complicate it by making it busy. I mean, this exercise is pretty simple, but you got to implement it, right? It's action over everything.
Yeah, we got to do it. And self-care takes effort.
Amen.
Let me go ahead and go ahead and share my screen again. Can everybody see that okay? Or is my little, oh, that disappears. Okay. You know, what is adult learning theory? And basically, it is what the title says it is. It's a theory that science uses to describe adults learning, you know, but it's comes from Malcolm Knowles developed, he's a famous adult educator, and he developed the term, and it was first introduced by him, androgyny. And it's a learner focused method contact contrasted by pediology, which is more of a teacher focused method. And when we're talking about that, when we're talking about adult learning theory, and we'll dig into this a little bit, when we're teaching children, it's focused on a teacher and what information the teacher's putting out and how that teacher presents the information. And when we shift in that focus to that adult learner, it's important for us to really understand that these adult learners, they have a wide variety of experiences and they have different methods and different ways that they learn the best. And you'll see a lot of institutions, a lot of places have really instituted this, even with employees, and they'll ask people for a self-survey. How do you learn best? Is it by doing? Is it by observing? Is it by reading information on the task and different things like that, and trying to tailor the way we teach to the learners that we have in front of us. And there's 4 basic principles. And the first one, the adults, they're really involved in their learning process. they got some investment into it. Oftentimes it's something they decided that they wanted to learn. They have some interest in it. And, you know, that experience provides the basis for their learning. And we talked about that, the way the brain develops all these shortcuts. You're going to hear something that's familiar, and the next thing you know, your brain's going to take you to something that was similar in your past experience to allow you a place, a frame of reference from. And the relevance and the impact to the learner's life matters. And that's that intrinsic part. How relevant is what you're putting down for me to me? You know, like for people that sat in, probably many of you have sat in lectures and just zoned out. It's this, I don't see how this is important, how this is relevant to what I'm doing, to where if it's something that you're interested in, you're going to be zoned in, focused in as the adult learning. And then that last one, adult learning occurs on a need to know basis. And we can look at that. Adult learning is problems centered oftentimes rather than content oriented. And by that, I mean, you know, oftentimes adult learning is if my refrigerator takes a dump and I can't get a hold of someone to come and fix it, I'm going to get on YouTube and I'm going to look up some YouTube videos and try and diagnose and fix my refrigerator itself. It's oftentimes when we learn adults, it's that problem centered and just that, not that content orientated. But also when we talk about some of that adult learning occurs on that need to know basis, there are some people that when we look at these different principles, some people take things and they want to learn things just for the sake of knowledge. And there's that intrinsic motivation that some people have, and that maybe not necessarily a problem-centered approach, but the relevance and the impact to the learner's life matters in that case. You know, they value knowledge, they value knowing. And that's one of the important things, you know, as we go through it and we're thinking about that. And, you know, as a coach, you know, it's how do people learn? We got some different techniques that we maybe occasionally provide people information through EPE and different things like that, and understanding our clients. And, you know, some people making it more interactive, like using brainstorming, maybe another way to go on with it. But when we look at this and we're looking at adult learners, they tend to be autonomous and self-directed. They like to be free to make their decisions. And they really want to, most adult learners want to be directly involved in that learning process. And for most learners, they're goal oriented. They're learning something for a reason. Like people that are in this coaching course, they're learning these coaching skills because they hopefully want to implement the coaching skills in some sort of coaching venture. You know, like I use that reference. I'm going to pull up a YouTube video on how to troubleshoot a refrigerator if my refrigerator dies, because I got a goal of saving all that food in there before it goes bad, because food's expensive. And that ties into this next one, you know, that relevance oriented. There's got to be a reason for why we're doing it. And that reason, as I said, it can just be for the sake of knowledge, but oftentimes it's more than that. It's, if it's relevant in your life, if it matches our own values, it's something that we're going to do. And, you know, we have accumulated as those adult learners work experiences through its, whether it's work, you know, our interactions with other people, previous educational experiences, you know, and we have those. And when you're working with adult learners, you want to be able to take that that strength-based approach and understand that people often have with that. So, and the other thing is that adult learner, don't talk down to people, it's treat people with dignity and respect. The adult learner and our clients, they want to be treated with that respect that they know. And, everybody brings different things to the table, a wealth of knowledge, and being able to appreciate that and respect that really facilitates that adult learning process. And I just invite you, as we talk about this adult learning, everybody in this room is an adult. Just think about some of those characters and how they relate to you yourself as that adult learner. Rubber meeting the road. Applying that adult learning theory to the health and wellness coach. And that ideal coaching program, it's going to take into into its core the principles of the adult learning design. And some of the factors, that motivation. We're looking for that client's reason for change, their behaviors in the first place. Is it intrinsic or is it extrinsic? And that self-efficacy. We want to really look for that client's belief about their own ability to be successful. And then we want to be aware of some other situational factors, as we talked about, as we talked about, they need to value it. But like I said, humans' life circumstances, they can change on a dime. And that may also impact, their willingness or their interest in learning something new. Got another poll question. What do you think is one of the biggest perceived barriers adults face in relationship to achieving healthy lifestyle goals? Is it lack of time? Kimberly says none of the above. Lack of health insurance, lack of education. And the real answer is really none of the above. The perceived barriers run the gamut. And oftentimes, the barriers that we perceive for achieving our health style goals really require removing those barriers to adult learning. And, we got a global list. But all these are barriers to adult learning, and you guys can all look at that. But, unlike the children that are in grade school and maybe teenagers, adults have a lot more responsibilities that they got to balance with the demands of learning, and those situational factors, those life circumstances can present barriers and motivation that influence the adult learner's ability really to learn. And then, we're going to talk a little bit about, and you guys probably have seen this stuff, but when we're coaching and adult learners, and we're saying that just because that's when we're coaching anybody, we're going to respect their knowledge. We're going to assist them in identifying what motivates them. Understanding that they really generally know what they got to do. And identifying those motivators, looking for that intrinsic motivation, the research shows that it's motivation is really important when someone sets out to achieve their goals. And one of the neurosciences change, really as somebody's motivation increases, that intrinsic motivation increases, the perception of the size of the barriers will decrease. And really support those small changes. We help do that. We create those incremental goals, and we support those small changes. We build on those successes with our clients. We point them out. We point out their strengths. And we're going to acknowledge and affirm those barriers as they go forward. And we're going to offer that valuable feedback. And we use our reflections to offer feedback. We also, use some deeper inquiry when we're working with clients to offer that feedback with them. Anybody got any questions so far? All right, we're gonna jump into coaching theory, some overview. We're gonna dig into these. We're gonna talk about positive psychology, appreciative inquiry, social cognitive theory, social determination theory. Oh, this is a lot. The patient activation and engagement models. And then after that, we're gonna get into the motivational interviewing. And putting it all together. And we're going to start with positive psychology. This is really a cool theory, but positive psychology is really just the study of strengths and virtues that enable individuals and communities to flourish or thrive. And it's a little different from some other theories. A lot of other theories seek to diagnose or put labels on people, and positive psychology is really still in its infancy, but it involves a variety of techniques that encourage people to identify and further develop their own positive emotions, their own positive experiences and character traits. It really focuses on the good or focuses on the positive emotions and the personal strengths rather than pointing out the negative, what some people may consider, diagnosable traits. It complements the traditional psychology model, with that strength-based perspective and seeking the focus on highlight the good. And, even though it's in its infancy, it's already demonstrated the value in improving creativity, open-mindedness, strategic thinking, resiliency, that bounce back, that interconnection to self, and that interconnection to our own health. And as health coaches, it can help us better prepare for sessions, help guide our questions, and listen to our clients. It can also, equip us with some of those strategies that help clients succeed in reaching their goals by focusing on that positive psychology and seeking to focus on those positive emotions and personal strengths. It can help us guide those clients towards reaching their goals. And this is the Coaching Psychology Manual. It's a great book if to complement this course or just to enhance your coaching with skills and knowledge. And it's 12 chapters that encompass skills, presence, compassion, celebrating, building that self-efficacy, and various other things. And really, it's a foundational manual for as you develop as a coach. And deeper dive into positive psychology. It conducts research in the emotions, strengths, the processes, and the conditions, and the relationships that foster that optimal functioning and flourishing people, groups, and into institutions. And when I say it's in its infancy, it's way younger than I am. It was launched in the late 90s. And it was kind of launched as a counterbalance, you know, to that research focus on that pathology. And positive psychology really, it's for an emphasis on what's good about people. And it can be described as a scientific study of what goes right in life. And it's almost, positive psychology is almost runs counter to, a lot of our culture. And I experience this a lot when you ask somebody. I've done it where I've asked somebody, when I'm mentoring a coaching session even, and so what went well in that session? And they'll start telling me everything that went wrong. It's that shift in that perspective, from, because we're so focused and we're looking for that wrong and we're nitpicking and all that. It's that perspective shift to what's right, what's good about people. It's the study of those virtues and those strengths that enable individual and communities to flourish. But it's really, it comes down to it's a perspective shift with us. We're real quick to notice something that's wrong, something that's out of place, and that's part of the way our brains are programmed. But it's really, looking, I don't want to say that silver lining, but it's looking for the intrinsic good and what's right with certain situations. And Peterson just, it's that study of what makes life most worth living. And it's a scientific approach to studying humans' thoughts, feelings, and behavior with a focus on strengths instead of weaknesses. What's right? What's good? Building the good in life instead of, repairing the bad. And taking the lives of the average person up to great instead of focusing solely on moving those who are struggling up to normal. And it's a big paradigm shift. Even their traditional medical model is really just designed to get people to that neutral point, exist neutrally. And, even most other psychologies, they're designed to treat people and get them to that point. But positive psychology is really looking at focusing solely, or is really looking at getting people to flourish, to live in their best lives, to what's great. And that's really, it aligns beautifully with coaching, as we'll see. We look at it, coaching generates positivity by fostering capacity, resources, and process that are needed for successful change. And really, coaching helps those clients, the coach helps the clients, assist the clients in identifying what makes them flourish, what their right looks like, and building from, some those positive emotions and personal traits. And we got inspiration, hope, pride, interest, love, awe, amusement, joy, gratitude, serenity, and really working with people on those positive emotions and working forward and getting them to their goals. Which of the following is not one of the three pillars of positive psychology? Someone can throw it in the chat, or someone can speak it into the room. But One of those is not one of the pillars of positive psychology. And I'll give a little hint. It's really, when we're talking about the pillars, it's really those foundations, what's already there before we start to grow.
The
So,
positive development is not a part of one of the pillars.
spot on. Positive development, those positive traits, those experiences, those positive institutions, those are things that are already there, and we're gonna build on those. Those are really the pillars of that positive psychology model. Anybody know why the VA from Nevada is trying to call me? But positive psychology examines what helps people thrive and flourish. It really builds on those strengths. It nurtures them, bringing out the best in people. And the three main pillars are positive experience, as we talked about, those positive traits, and the positive institutions that someone may have in their life. And as coaches, when we're able to explore and help people to recognize the examples of the positive pillars in their own life, that can really be that foundation that they build on and they grow, that helps them move forward to living a great life for their fullest lives. And they're going to be the ones to define what's great and what their fullest life is. And that falls into this theory as well. And by using this, we really help clients open up the possibilities of what can be instead of just what is or what's wrong. And as that coach, we're going to use, listen for these things. We're going to highlight these things for the client in our own reflections and through the open-ended inquiry that we use. Just some examples of the way we can use some reflections to highlight the pillars. Just, John, you got a knack for seeing a big picture, even when it's not clear to others. We got that reflection, John just said something and you just observing back to him. You got a knack to see that big picture, even when it's not clear to others. And then just asking them that open-ended question. How could you use this strength of yours in your current situation? And oftentimes maybe that's something that through the coaching process, you notice that John often sees the big picture. And they're coming to you with a new dilemma and you're just reflecting back, John, the fact that to John that you've noticed that he sees the big picture, and then asking him how he can use that in his current situation. And then this is just, that validating, recognizing that strength that Martha recognizes that dissertation can make for a lonely Martha. And then using that inquiry to look for her to find, a place for support and encouragement as she goes on. There's a little model in positive psychology. And it's a PERMA model. The PERMA model describes foundations for, if you had to guess, we're talking about positive psychology. The PERMA model that I'm getting ready talks about well-being and flourishing, how to be happy all the time, rainbows and unicorns all the time. Talks about decreasing negative thoughts or how to deal with difficult people. Which one would we say it talks about?
So decreasing negative thoughts.
Decreasing negative thoughts. It will help bring that about, possibly, Mark. But
Uh-huh.
I'm going to go with well-being and flourishing. And, you know, that's one of those things that's almost like an exam question. And the reason we're going with that is, you know, it's positive psychology. We're strength-based. We're gonna look that's the perspective we want to come about. You know, not that focus on what's wrong. What's wrong is I have too many negative thoughts. I want to decrease them. We want to reframe that to, you know, I want to increase, I want to be well and flourish. And the PERMA model for well-being is the foundation for flourishing. And the PERMA model, here it is, I'm spelling it out. It's positive emotions coupled with engagement. You know, we got those positive emotions. We're engaged in our own change process, or we're engaged in whatever it is. We have good relationships. We get encouragement from our relationships. They're quality relationships. We're getting something from our relationships. What we're doing has meaning. You know, we see where it fits with our overall vision. And, you know, accomplishments, that satisfaction, that feeling of accomplishment, of knowing that we did something, we set out to do it, and we did it. And then we're going to talk about a little permanent practice. And this is a self-reflective exercise. Just, we're going to allow you guys to consider your current situation, either personally, professionally, both. Now I'm going to ask you a few questions. Just consider this. What do you want more of in your life? When do you feel you're at your best? What's something you did in the last year that you were proud of? And, you know, this can be used in other venues too, this positive psychology. And there's other questions that we can ask. And for those of you that don't know, my day job, I'm a program manager for the VA whole health, and got 9 coaches. And today we had a coach gathering. All the coaches came to the main facility, but one of my coaches he's a lead coach, and he opened the meeting by asking the following 3 questions. He asked them, you know, other than, you know, better serving your veterans, what would you like to see more of in your day-to-day job? Then he asked the other questions. Tell me about a time where you had an impact on a client that you were coaching. And then he asked, what's something that you're proud of? And it was a way to open it. And it's, you know, it's grained in that positive psychology. It kind of set the tone for the rest of that 4-hour gathering that we had. And it's just another way of doing that. Does anybody out there have any other sample questions that they can think of that get to that? No, that last one, what is something you did in the last year that you were proud of? Oftentimes we'll ask clients, tell me about any a past success you might have had in an area or something that's related to this, looking for those strengths. We're often asking clients, what do you want more of in your life? But looking at those value-based questions that we can ask, just simply, what brings you joy? What brings you happiness? What's important to you? What do you want your health for? Looking different things like that. Those are all coaching questions that readily fall into that positive psychology model. And in general, just the goals of the positive psychology, we want to have a positive impact on that client's life. And that's above all others. And all the others, they feed into this goal. Because really, when it boils down to it, the main goal of the coach is to assist that client or guide them on that journey to improve that client's life. And we do this by increasing that client's experience with that positive emotion, help the clients to identify and develop their strengths and unique talents. And I'll emphasize that, help the clients to identify their strengths, because I have yet to meet anybody that doesn't have some. Really work with those clients on enhancing that goal setting abilities. As we work with clients, science tells us the smarter we can help somebody make a SMART goal, the more likely, the more specific and the clearer the goal is, the more likely for success they'll have. And we use that working with our clients on honing that up. And just helping to nurture that sense of gratitude in the client. And we can do this in lots of different ways. We can ask the client what you're thankful for. We can provide resources on gratitude practices. And that hope, that anticipation, that hope into that client's perspective. And that's kind of the opposite of that doom and gloom. We do that by reinforcing those strengths, letting them know, hey, you've overcome adversity before. Instill that hope they can do it again. And all that builds up, cultivating that client's sense of happiness and well-being. And really, as the client's working through anything, those positive relationships, we're social by nature, can have a real positive impact on individuals. So help the client to build and maintain those healthy, positive relationships with others. And really through coaching, we encourage that client to maintain that optimistic outlook when we look at something. And sometimes it's a perspective shift for some people, but building on that, because two things can be true at the same time. The glass is both half full and half empty at the same time. Our perspective really informs our outlook and how we go through and approach things. Questions on positive psychology? Really cool theory. And if it's in its infancy again, but the more I dig into positive psychology, the more I want to learn about positive psychology, because it really, it fits coaching very nicely. We're going to go ahead and move into appreciative inquiry. And I just can't say AI without thinking of Skynet and artificial intelligence. So I'm going to continue to talk about appreciative inquiry without abbreviating it. But it's that philosophy as an approach for motivating change and enhancing well-being. Again, not the oldest one. Been around since the late 80s. Originally part of that transformational change process within organizations and groups. But it's got a variety of purposes now that it's been adapted for. Again, appreciative inquiry is strength focused and imagining possibilities to help us move through our problems. And appreciative inquiry is those coaches. It really allows us to uncover and celebrate what's best and what could be, instead of what's wrong and what'll never happen. You know, and it really boils down to me to paraphrase that. If you can see it, it can be, you know, once he or man or humans become conscious of creating images of the future, we become a participant in the process of creating this future. Once you become conscious, or once you start to see and imagine that future, you're a participant in creating that future. And here's really the 5 principles shown in a pyramid, with the very peak being that positive actions and outcomes. You know, belief is the desire of each of us in every day in some way. You know, that we're after that positive action and outcomes, but we don't have to apply these principles in the order that we don't have to build and apply them in this order. They're more like, these principles are more like tools in your toolbox to pull out when they're in that needed moment. But you got that positive attention in the present moment, or that poetic principle, being there. And we help foster that as coaches by creating that safe space, that sacred space for that coaching session to occur in. That anticipatory principle, or, you know, building on that hope, that anticipation, that excitement, you know, kid getting ready to open presents on Christmas Day, they get excited in that anticipation. And that simultaneous principle, those questions and reflections, they're coming all at the same time. And really that relationships, those constructionalist principle, you know, positive conversations and interactions. Then we got our energies and our emotions, and those actions and outcomes. An appreciative inquiry is a little different than problem solving. Click. But problem solving, we're going to analyze. We're going to provide answers. We're going to place blame, find that cause. Then we're going to consider solutions and fix with an expert. And, you know, problem solving, not always the most effective way, because, I've sat across from clients and talked to them for a while and thought to myself, if you just do everything I say, your life will be rainbows and unicorns. But unfortunately, people don't do things because they're told to. They do them because they want to. And, appreciative inquiry can help that person find their want to. But instead of, analyzing and looking at problems, we're going to appreciate what's going well. We're going to use that inquiry. We're going to use questions. We're not placing blame. We're owning and collaborating. And instead of, that consider solutions, how do I fix this problem? Coming from that strength-based perspective, we're going to envision what could be possible. And we're going to leverage the positive. And we're going to do these with a lot of skills that everybody is familiar with already. But we're going to create some rapport, ask some open-ended questions. We're going to note those potential challenges or barriers that they can come up with and make an offer in their words. We're using that appreciative inquiry to really, it fits coaching. We build that sacred space, that trust. We get that rapport with them. We use open-ended questions. We can use reflections, open-ended questions to note potential challenges. And we're going to get them to really look for that solution, that focus and envision what can be. Oh, and we're almost there to where Haley's taking over to the switch. So you guys are getting a break. I'm going to power through though, and we're going to switch to social cognitive theory. And we're just going to take a look at this, but it's this, and I'm telling you, everything that we're talking about, it's a pretty high level overview of them. You can take deeper dives, but that SCT, social cognitive theory, every one of these factors plays into it. And it suggests that all health behaviors are goal driven through the anticipation of the outcomes. And it's always going to, all those arrows, they go boom, 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 because personal factors are going to impact behaviors. Behaviors are going to influence our personal factors. The environment is influencing both. Everything, it's interactive in social cognitive theory. Knee bone's connected to shin bone. Everything's interrelated. Or how we act, and we may even exhibit different behaviors in different environments. If you're new to something, maybe you're normally outgoing, you may be a little, so your environment can influence your behaviors. Your personal factors can also influence our behaviors, and the fact that maybe you are that robust, outgoing person, and it doesn't matter which environment you're going to do, you're going to be outspoken regardless. But everything is interactive. And that social cognitive theory speaks to the fact that importance of observation, imitation, and modeling of one's perceived self-efficacy. And a lot of clients, they're going to be hesitant to dive into that change. They don't believe that they can sustain that new habit. Just their self-efficacy is not high enough to begin the behavior change. And as coaches, we can work with the client to improve that self-efficacy by utilizing, some social learning theory and some self-efficacy theory as we go forward. And social cognitive theory, that social learning theory, that self-efficacy theory, as I talked about, Our behaviors are goal centered, our health behaviors, because we're health and wellness coaches, the focus is on that, are driven through that anticipation of the outcome. And as I said, there's a constant interaction again between the personal factors, the person's environment, and our behaviors. Those personal factors are thoughts, to consider the present situation, previous experience, and look at expected outcome. Again, we go back to adult learning theory, you know, a lot of what we're going to anticipate that outcome to be is going to be based on our past experiences. And then we can tie in, you know, that positive psychology, appreciative inquiry. We're trying to help people identify those strengths, encourage that self-efficacy. And the environment, that's just the social and physical situation in which we act, and those behaviors, those are our actions. And the self-efficacy beliefs influence all of this. It's really important for us to understand as that coach that understanding the clients are capable, you know, clients are capable of self-regulating their actions and choosing situations and environments that's going to help positively influence their behaviors. And, you know, another thing about this is we all are active participants in maintaining, changing our own behaviors. Consider the following. Carlos wants to eat healthier and be more active. He and his coworkers eat together every day in the lunchroom and usually get fast food 2 to 3 times a week. They spend their lunch breaks eating and talking. What is important to consider when coaching Carlos and coming up with a plan for eating healthier and being more active? And we're using that social cognitive theory lens when we talk about that. We got personal factors, the environment, and the behaviors. When you're looking at that scenario, Carlos wants to eat healthier and be more active. And he also has lunch with his coworkers, eating together in the lunchroom, and usually gets fast food 2 to 3 times a week. They spend their lunch breaks eating and talking. What factors are important to consider when we're looking at this?
He's not being active and he's eating unhealthy food consistently.
He's not being active and he's eating unhealthy foods. But when we look at that social cognitive lunch, you know, he's getting something out of that. He's getting some socialization, some positive relationships at his lunch breaks, right? That's a
Yes.
social factor that plays into it. He's getting that social,
Sorry,
and then that environment where he eats in, that's a factor that plays into it and it influences it. When we think about it that way. So we want to consider all those different angles that we're looking at from it. You know, he wants to eat healthier. He probably understands what healthier eating looks like, but he's also getting something internally from socializing with his coworkers and having that social time at lunch. You know, when we think about that, what do you think will help him be successful?
If you could make sure he still had the social, see if anyone in the group wanted to eat healthier and if anyone would be interested at lunchtime, maybe going on a walk, or if anybody, he could still have the social aspect, but if there are things he could do that would just
Yeah,
be healthy but not lose the social.
that social aspect, explore with him, if that social supports and maybe that a walking lunch with somebody may work, or maybe, that social aspect, it's got to be his plan, but maybe he can meal prep and bring his own prepared meals that are healthier food, and he can still be in that break room and socialize somebody. But those are all different things, that social cognitive theory helps play into what we're going with.
I have a quick question.
Yep.
When we speak about that, obviously eating healthier and being more active is something that's important and what we want to guide them through, but not or well, I mean, we're trying to guide them through that scenario, but I know that we talk about the coaching where we're not really not telling them what to do, because I know we're coaching them and guiding them. So it would be important, I guess you would say, to then have like these like open-ended questions that are in that genre of like what we not want them to do, but for them have that self-discovery, like what barriers may be impeding you from, eating healthier, and he can identify that as I'm assuming that's what we're trying to do.
Yeah, 100%. We already got from the scenario Carlos wants. He has that desire to eat healthier and be more active. He laid out that scenario, that he and his coworkers eat together every day in the lunchroom and usually get fast food. And so, you're going to use that inquiry, and explore those barriers. That fast food, is eating fast food 2 to 3 times a week really a healthy option? And get him that come to those realizations. And what the social cognitive theory allows for us as a coach is to better meet that client where they're at. We're understanding that these environmental factors and those behavioral factors, that they influence each other. So it can help inform our questions that we ask, and it help form the process, but it's still going to be the client's plan in the end. So yeah, good question, Armando.
Thank you.
I feel like a little bit of hypocrite. My wife just dropped some mozzarella sticks off by me. Talking about eating healthier. And according to social cognitive theory, we learn by what? Reading about it, thinking deeply about it, observing and imitating others in our environment, or doing experiments in a lab setting. And this one is monkey see, monkey do. We're social cognitive theory, by observing those behaviors, we do it. And that we go back to Carlos, and one of the things with Carlos is that environment, his friends are all getting fast food. He picked it up. But conversely, it can also play the other way. Carlos may develop that plan that he's going to meal prep, bring his own healthier meal to eat, and he's eating there and he's still learning. Other people may pick that up from him. So social cognitive theory, that learning can go both ways. But it really boils down to, that person, environment, and behavior. It's a dynamic interaction between them. And at one point, one can influence more than the other, but it's a dynamic interaction. And it really states that, the learning is observing, modeling, and imitating. Consider the following scenario. Oh, I should have screened these. That's the same one we went for. We just did that with Carlos instead of Cora. But how do we define self-efficacy? one's beliefs in their own abilities, when others believe we can, being efficient, productive, and focused, or knowing where and when to get support.
One's one's belief in their abilities to successfully complete tasks.
A, one's beliefs in self-efficacy, that it's kind of in the question, just one's beliefs in their own abilities to successfully complete task. And that's one of the things that we look to as coaches to help foster, to help grow in our clients. Mastery of skills and knowledge, that person's belief, that confidence that I can do it. Why do you think self-efficacy is important in health coaching?
I would say that is important because it gives them like the autonomy, like the what we talk about, the psychological needs, the competence, the autonomy, the relatedness. I think that's the third one. I can't remember, but
Gives them
it's
that,
just providing that. Yeah.
yeah, that confidence, that autonomy, that 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 belief in oneself. It helps promote that intrinsic motivation, and when we build confidence, generally challenges and barriers diminish. It really helps with that. And we encourage that self-efficacy in our clients through our use of reflections and inquiry. Those reflections that help them identify strengths, that are observational in nature, can be really, instead of that rah stuff, but a reflection that you set out to do X and you accomplished X. Boom. That's one of the ways we help build self-efficacy. And this is the last one for me, and then you guys will get rid of me in a little bit here, and we'll go on break, probably right on time. But the social determination theory, and that's autonomy, relatedness, and competence all feed into the social determination theory. And it suggests that oh, that people are motivated to grow and change by those three inherent and those universal psychological needs that we have for autonomy. Feeling like, I'm the author of my own story. I'm in control of my own behaviors. That confidence, we're effective at what we set out to do. And then that relatedness is just that connectedness to others, that commonality with others. And just people, intrinsic motivation rather than extrinsic motivations. People feel more motivated when they feel that what they do will have an effect, an outcome. And when they're engaging in activities that are really inherent rewards of the behavior itself, plays an important role in that self-determination theory. But that intrinsically motivated versus intrinsically motivated, and what comes from within is more powerful than what comes from without. And, in psychology, self-determination is an important concept. Just it refers to that someone's ability to make and manage their own life. that ability to plays an important role in their psychological health and their well-being. But again, autonomy, competence, relatedness. I write my book. My book makes sense. My book's effective. And, other people are connected to my book, my story. Equals self-determination, intrinsic versus that intrinsic motivation. Intrinsic, people do things because they want to, not because they're told to, or not because they have to. Oh, according to self-determination, we all have a need for I'll help you out. This one is that psychological growth, that self-determination period. We're always growing. I joke that I'm growing out instead of up, but we're always growing. We're seeking, whether that psychological growth, where we fit in, finding ourselves. That psychological growth, self-determination talks about that. Because we're wired to grow and change, that psychological growth. And we want to have some autonomy and make our own choices and have control over our own life. Those universal needs, and I talked about this one extensively, but according to self-determination theory, we have universal psychological needs include, it's gonna be competence, connectedness, and autonomy. We want to have that control. We want to be able to do it, and we want to be connected to others. Competence, being a master of skills and the ability to learn new ones. That connectedness, belong and relate to others. Just autonomy, feeling in control of our own destiny. How do you think we can facilitate that self-determination theory with our clients?
Having them being in control, like they're the ones making the decisions. You're just guiding them.
We follow the client's lead. I often like in coaching, the client drives the bus, the coach sits next to him. We got a map, but our map's not to tell them where to go. Our map's so we can keep up if they take a hard left. And oftentimes in coaching, you're gonna get clients say, just tell me what to do. You're a professional. What do you suggest? And they may be even uncomfortable when they're given the space, and the freedom to explore what they want and to get to choose. But that's up to us as coaches to really use that guiding style to give them that space, to facilitate that growth as they move forward. All right. I was 3 minutes ahead of where I wanted to be, Haley.
Did a great job. I'm impressed. That was a lot of material. All right. So, any questions for Todd before we let him go to bed? And you guys are stuck with me the rest of the night. now's the time, because I'm not that smart. No, I'm just kidding.
She's wicked smart.
Wicked. I do like that musical, but I can't say I'm wicked smart. All right. Thank you, Todd. We appreciate it.
Thank you.
So let's do, say, like, you want to do here's what we can do. Here's your options. We could do a 10-minute break and then have a 5-minute break a little bit into it, so you don't have to sit a whole hour and a half. Or we can do a 15-minute break now, and then we'll knock out the last hour and a half. What's your preference? 15 minutes, Kimberly says. That's the first one that popped up, so it works. All right, so 15 minutes, and then we will be back. We'll just round it up to 30, so see you back at, my time would be 7:45, whatever your time is with the 45. All right. Hope you guys had a good little break. I forgot to take a break after all that. I just sat here and kept on doing stuff. Don't know why I did that. All right. So we're gonna jump into a few more models that we want to talk to you about. So just a little bit of background for those of you who don't know Charlie. Charlie and I have kind of worked through different things that we utilized at the VA, things that we utilized at different colleges when we taught these courses there and created their courses. And to be honest with you, we've learned that with these theories, they may not all be on, obviously, the exam, but they're good to know when it comes down to actually utilizing coaching skills and being in the real world, in that real setting. Charlie has a background in social work, and I do the health and wellness coaching as far as just being board certified. I don't have the mental health background, but we've noticed that a lot of these models come into play regardless. Now, a lot of the things that Todd talked about tonight, those are very important. Those are some of those like milestone theories and models that you definitely need to know, especially if you're planning to take the board exam, or if you have taken the exam, you already know that a lot of that was information that was on there. So be able to utilize that information and think about it in real world settings as you start to use it with your patients or your clients. I say patients, I try to say clients more. I'm still in that VA head space where I say patients. So sorry ahead of time if I keep using that. So we're going to jump into patient activation and engagement models, and that's not going to take us too long. We'll kind of finish up with that, and then we're going to jump into the good stuff of motivational interviewing. It's one of my faves. So any questions before we jump in for the last half of the class tonight? Cool beans. We're gonna jump into it then. My Zoom updated and all my buttons look different, so it takes me a second to figure this bad boy out here. PowerPoint it is. Everybody see that? Okay. So let's jump into this. First thing we're gonna do is Uh, ask you a question. So the patient activation model recognizes and describes, what do you think? It's okay to guess on this. Is it A, how medical providers can effectively prescribe treatments to patients? B, ways for patients to be compliant with treatment? C, the importance of seeking alternative medical care? Or D, how to get patients involved in gaining the knowledge and skills to better manage their health? Think of it as a coach. What you think?
I think D.
Feeling D? Anybody else have anything different? You are correct. D is the right answer. Absolutely. So as coaches, we want to make sure that we are consistently providing those tools, providing the space, anything we can to help clients engage in their own healthcare, right? We're not there to tell them what to do. We want to help them to gain that experience, that knowledge, and that, honestly, that kind of confidence really to take over and do it themselves. So let's talk a little bit about this model here. So patient activation engagement models, they're really there to facilitate knowledge, skills, and confidence. We want them to take a hold of that healthcare. So when we were at the VA, we called it whole health. I think they call it a lot of different things in the private sector, but basically all it is saying, listen, here's all the tools, here's all the things that are available, your resources that you can utilize. What speaks to you? What's going to work for you? Because ultimately, if it's not speaking to them, if it's not something that they think is going to work, it's not going to. Nobody is going to do something because I tell them to do it, right? They have to want to do that. They want to be able to take that skill set and utilize it for their own health. So in this, there was a lady named Judith Hibbard. Hibbard, I think that was her name. I better double check before I start lying, y'all. Yep, it's in my notes. Hibbard. She actually described this concept in 4 levels. And basically, it's a newer concept that describes the importance of engaging the patients into their care, like we just said. So early research suggested that the patient activation can improve health outcomes and patients' overall health care, and potentially lower the cost of healthcare altogether. Now, why would we think that? Why would that go hand in hand? Patients overall taking their own healthcare into their own hands, how would that help lower healthcare costs? Any guesses? Maybe think of it. Oh, Armando, see you through there.
I would say they're getting that knowledge and understanding, and so they can actively do this stuff on their own. And so by doing that, you're creating like these healthy habits that they've made on their own, and they don't need to be coming into the doctor as much or hospitals and things of that nature because they're taking care of it themselves, or at least the hard stuff or the small stuff.
Absolutely. Yeah. So think of it this way. If I am doing what I need to be doing, eating healthier, working out, taking care of my mental health, being proactive, and all those things, I'm probably less likely to have, I don't know, let's just throw some things out there. Diabetes, metabolic syndrome, whatever you want to talk about. I'm probably less likely to have emergency situations that involve that, right? Obviously, a primary care provider yearly checkup is a lot cheaper than me going to the ER, right? So you're starting to see how if we are proactive in our healthcare, if we're taking care of ourselves in the long run, yeah, that's going to help across the board. And then you think about it, go even further with that. We see national emergency rooms numbers and everything else. It's hard to keep up, right? It's hard for people to keep up and get into the places they need in a timely manner. Well, it's going to free some of that space up as well for the people that truly need it when it comes down to it. So overall, it would be just kind of this domino effect, really. And we are starting to see that a lot. So you start to see that insurance companies are even more willing to start supporting health and wellness coaching. They're looking at I don't know what insurance, I think it was Blue Cross Blue Shield I had at one time. They would even pay for part of my monthly membership for gyms and things like that. So they're definitely taking note and being a part of that. So this brings the patient from a passive knowledge base to an active knowledge participant. And then it empowers them to become decision makers. There is nothing more exciting than to see somebody advocate for their own health care. I love it. I love it when I go into different hospitals and I'm working on different contracts and I can see patients truly taking an active part of their health care. Okay, so this one shouldn't be too tricky. The benefits of patient activation includes all the following except what you think. A, increased knowledge and skills for the patient. B, a strict treatment plan that requires complete compliance. C, lower healthcare costs. Or D, improved patient experience. I'll pay attention to my chats this time too. See, I got some B's. See if you're right. Ding, ding, ding. Correct answer B. Charlie will be sending you all an ice cream cone when he gets back. He'll let you know when you get them. That's right. B. Come on, button. All right. So we talked about the early research about patient activation and how it can improve their health outcomes. We know that. We know that it could potentially lower cost of healthcare. Ultimately, we're going to go back to this theme we've talked about all night. It's the strength theories. We go back to their strengths. How are we going to get people involved in their own healthcare? How are we going to get people excited about it? We go back to what their strengths are. How do we do that? You remember when Todd earlier was asking the questions of what's important to you? The why question. Why do you want this? It's getting those open-ended questions in there to ask patients or clients, stop it with the patients, clients, what it is they really want and why they want it. People are going to function better if they are using their own strengths. They are going to function at the top of their strengths if we tap into their values, we tap into their why, and then we really start to engage in utilizing the tools, whether they have the tools ahead of time or we teach them tools and get to see them excited about utilizing them. So either way. So talking about those strengths, let's talk about the likelihood of health behavior changes. So we talked about pre-contemplation earlier, contemplation, we went through that whole scenario. Here's the thing. People are going to engage in health behaviors a lot of times if they see or perceive threats. What does that mean? It can mean a lot of things. For instance, my dad had absolutely zero ambition to lose weight. He had zero ambition to eat better, to start working out, really doing anything for himself until he was diagnosed with diabetes. All of a sudden, that was a threat. That was something that changed his world. It changed his thought of how he could move forward in life, right? It could affect a lot of different things in his life. So a threat can be something that truly opens somebody's eyes. Even just being told you're pre-diabetic could scare the crap out of me. I know that much. So these are things that you want to think about when you're coaching people. You want to identify if they have, by chance, received some kind of news like that. Do they perceive barriers? Do they perceive that there's something that is ahead that could be a risk or a threat? You also want to address the severity of it. Do they think it's something severe? Is it a perceived susceptibility? Then on the flip side, you want to engage with your client to also see if there's perceived benefits to a change. This is where you start talking about the strengths, right? What happens? What does life look like if you were to make this change? There's also personal factors to consider as well as cues to action. What do you think I mean by cues to action? Any guess?
Cues to action, like things that are showing them they're going to need to take the action. I'm not really sure.
Possibly, yeah. There could be some like little cues throughout their journey that actually kind of make them want to start.
Like maybe they have a hard time walking because they're so overweight or they're not moving, or it could be something like that. They're not feeling good. Okay.
100%, absolutely. Could also be cues to action when you talk to somebody and they talk about maybe something that they wish they could have done or they wish they could do. For instance, I had somebody that I was coaching that really, really wanted to do a, oh shoot, I just went blank. It's that mud thing, mud runner. I don't know, whatever it is. They basically run through the mud and get shocked and all that crazy stuff, climb up crazy hills. That was a cue for action for her. She really wanted to do something. Was she capable of doing it right that second? Maybe not. But something in her made her want to achieve something at a higher level, a higher ability, and it cued her to start thinking and talking through it and wanting to achieve it, right? So it could be a lot of different things. So, this is the theory of action and planned behavior. Again, I told you the backstory about Charlie as far as being a social worker. This is why we threw some of these in here, because these are things that we know in the mental health care world that are just good information to know, right? This is good stuff to just understand that there's a lot of complex things going on in the human brain. So you just want to be aware. So this theory in general is used to understand and predict determinants of health-related behaviors. The general premise behind this theory is that the intention to perform health behaviors is related to actual performance of those behaviors. Okay. So you have your subjective norms, and this kind of goes in a little triangle here. You have your self-efficacy, we talked about earlier with Todd, and you have your attitudes. And truly, the three work off of each other. So behavior is due largely to rationale or rational decision making. So a person's intention to perform a behavior are formed by the influence of maybe significant others, subjective norms in general. This could refer to something like a person's beliefs, others' thinkings that are around them, maybe their friends. Could be a lot of different things. Attitudes toward a behavior really do predict its outcome as well. So think about it in this way. If I have a massive attitude about doing group workouts, I'm probably not going to enjoy group workouts, am I? Your attitude is going to predict how you perform. If I get to the gym and it's a group workout and I hate group workouts, I'm probably not going to be at my best. I don't hate group workouts, actually. They make me do better. And then there's the perceived behavioral control just in general, and your self-efficacy, I can't ever say that word, and your own beliefs too. So it really does kind of stack on each other. And so you have to take that into account too when you're coaching somebody. Kind of adjust and just to see where they are in their thinking and their processing of different outcomes and different goals. Again, not something you have to diagnose. It's just something to just be aware of. Just know. We're not in the business of diagnosing as coaches, so you don't have to worry about all that. That's why I tell Trey, I got the good end by being a coach and not a therapist. I don't have to like fix things. I just listen. All right, so putting it all together tonight, I told you we'd go through that little last part pretty quick. when you put all of these theories and models together, what really stands out to you? How does all of this connect back to coaching? You can just pop in and say it. You can put it in the chat, whatever you want to. This is mostly just me making sure you're still awake and we haven't bored you to death tonight.
I would say that it's pretty much just putting it in their hands, like they're in control and just guiding it and really working along and just being curious. Like I think one of the big things is everyone tends to overthink it, but just I always see it as just having a conversation and then getting to know that person and just guiding them to what they're telling you.
100%. I like that. I like that a lot. So Armando, you actually kind of made a great segue into motivational interviewing, because that is going to peg right into what we're about to step into next. But yes, it's all about just being an active listener. That's right. Fist pump. I just watched some trash TV, Jersey Shore, for any of you that know what that is. It's just trash, but it just, you don't have to think about it, but they do a lot of fist pumping. So you just made me think of that, Armando. Appreciate it.
You're welcome.
So yeah. It really comes down to, as a coach, we're there to be curious, right? We're there to kind of hold that map out in front of them that they're drawing. You're not necessarily leading them by any means. You are guiding them through the journey they are creating for themselves. So when it comes down to listening, picking up on those strength-based approaches, picking up on their values, what it is that really motivates them, that's when all of this really comes into play. And it really makes a difference just to even have some of this information under your belt to truly understand where they're coming from. Okay, so now I got something fun for you. Oh, I got chats too. Hold up. I got to remember to read these. So we've got one that says, it comes back to being client-centered, 100%. You will never go wrong if you stay client-centered. Yeah, another one says, human behavior can be understood through the application of psychological theories. Coaching can help the client understand and gain self-awareness, paving the way for change. Whew, Kimberly, all right. Nice words. Writing book over there. I like it. Wish I could put words together that nicely on the fly. Well done. All right, so sounds like you guys got a grasp on this. Fantastic work. So we are going to move into motivational interviewing, and I have a fun little something before we start. Death by PowerPoints. I'm not a big PowerPoint fan. I like to just talk and have conversations, so I interrupt my own PowerPoints quite a bit for those of you that are new tonight. Okie doke. So I'm going to throw in a little video, and then I'm going to ask you a question about it here. Oh, wait, I got to share my sound on. Miss that button every time. Tell me what you think about this. Let me know if you can't hear it, by the way.
What's stopping you? Are you too tired? Didn't get enough sleep? Don't have enough energy? Don't have enough time? Is that what's stopping you right now? Don't have enough money? The thing? Or is the thing that's stopping you, you?
Excuses sound best to the person that's making them up. Stop feeling sorry for yourself. Get off the pity potty. Telling everybody your sad and sob stories, trying to get people to show up to your pity potties and your pity parades. If you ever see me in a Rolls Royce, a 6 or 7 star hotel, living my life to the fullest, don't get jealous of me, because I worked my ass off to get it. Nobody handed me nothing. Wake your ass up. Awaken the beast inside. It's game on. It's go season. It's time for you to take advantage of the access and the resources that you have in your country and your community. You got a problem with your life? You got a problem with your environment? Do something about it. If you want it, go get it.
Recognize the excuses are not valid. They're conjured up, they're fabricated, they're lies. And how do you stop the lies? You stop the lies with the truth. And the truth is, you have time. You have the skill, you have the knowledge and the support and the willpower and the discipline to get it done.
The fruit of everything good in life begins with a challenge. Everything is uphill that's worthwhile. And it's not going to come to you, and it's not going to fall in your lap, and it's not going to be something that, oh my God, it just was so simple. It's always going to be difficult.
If you want it, you gotta go get it.
This is your chance. This is your shot. This is your moment. This is your time. This is your place. This is your opportunity.
This is my time. This is my moment. Tomorrow. Ain't no such thing as tomorrow. We only got today. It's your dream. If you wanted to have it, get your butt up and make it happen. If you wanted to have it, rise and grind.
You still got work to do. Stay on that basketball court. Stay on that football field. It's grind season, homie.
Okay. So I'm going to tell you a couple of reasons why I showed that before we jump into motivational interviewing. One, as coaches, we can't say those things to our people. However, when we talk about motivational interviewing, we talk about, again, getting into the mindset of the person that we're coaching, right? We got to understand what motivates them. I'm going to tell you, when I have to get up at 4 o'clock in the morning sometimes to get a workout in, a video like that's going to motivate me. That's me. I can do that. That gives me chill bumps. I get excited and I'm ready to roll by the time I watch something like that. But I can't talk to other people like that to get them motivated. So how the heck do we get them excited? How do we get them to a point where they have those chill bumps, where they have that blood going and they're ready to take on the world with whatever it is? It all starts with the motivational interviewing. That's really a baseline for coaching. It truly is. So now I'll go back to my boring slides before we get off calendar here. The name of this clip? Oh, Brock, that's a great question. Hopefully I didn't just turn it off your thing.
No, that's all right. I liked it.
You liked it? Yeah.
Yeah, it's good. I'm ready to go like run through a wall real quick.
Go ahead. Go ahead and run through a wall. Come back. Actually,
man.
don't run through a wall. Don't break anything on my watch.
I like my guy Jocko. He started it off. That was kind of cool. So
100%. Jocko is the main. And if any of you don't know who Jocko is, talk to me after class. We got some talking to do. All right. So let me share this again and we'll be on it. I need like a personal assistant to just like move my screens around for me because I get a little confused when I'm doing it. Got too many screens up. Okay, so let's talk about some motivational interviewing and the skills that we truly need to be an efficient and effective coach. Dun, dun, dun. Lost it. There we go. Now I can see y'all's face. I hate whenever I turn on the slide thing and I'll lose your faces and I feel like I'm talking to myself. All right, so motivational interviewing. Here's a great quote. People are generally better persuaded by the reasons which they have themselves discovered than by those which have come into the mind of others. I'm going to tell you right now, every time my doctor tells me something and says, I should be doing this, I almost want to be defiant and not do it because I'm being told to. Sorry ahead of time if you hear my dogs barking in the background. And I would venture to say I'm not the only one in this world out there that doesn't like that. I want a provider, I want a coach, I want somebody in my life that is having a conversation with me about why I want to be healthy, why I want to do things the way I want to do them, and how am I going to get there, versus you telling me go take a pill or whatever the case is, right? So motivational interviewing has quite a few different definitions here. For a layperson's definition, motivational interviewing is a collaborative conversation style for strengthening a person's own motivation and commitment to change. That's what I'm talking about. I want those kind of conversations. A practitioner's definition could be something like MI is a person-centered counseling style, addressing the common problem of ambivalence about the change. And then it's got your technical definition. So all of these came from the motivational interviewing book that we've spoken about in several of our classes. There is a new version out there. I think that the board recommends that you look at. But overall, so far from what I've read, there's not too many edits through there. So if you have the old one, it's still okay. So motivational interviewing key points. Here's some overall things you want to think about, right? So the overall style of MI is one of guiding. Armando talked about that earlier with what we've talked about so far tonight. It's all about guiding. Now, let me put some brakes on that guiding word, because some people get a little bit excited and then they want to guide the conversation into answering what they want the answer to be. You know what I'm talking about. You've had people do it to you before. That's not what coaching is. We're guiding on the principle of what they are wanting, right? We're not leading them into the corner we want them to go to. Ambivalence is normal. Holy crap, it is part of it. It is why we have jobs as coaches. But I'll tell you something. If you find yourself working harder than your client for them to get to a goal, you may want to introduce some motivational interviewing and figure out truly what it is that's causing them to stumble or have those barriers or not even really want to go in the direction they said they wanted to go. When a helper uses a directing style and argues for change with a person who is ambivalent, it naturally brings out the person's opposite arguments. Not sure why it's in there, but just some good information, I suppose. People are more likely to be persuaded by what they hear themselves say. We mentioned that earlier. So here's the framework for MI. We're going to break this down. And I'm going to tell you something. I have to break this down dummy style. So we're going to get real just point to point here, because all these little acronyms can get really confusing, but they're really good. So if you've never heard them, take some notes because it's good stuff. So let's talk about spirit. Bam, it's right there on the top. So when we talk about the spirit of motivational interviewing, it can be characterized by an attitude or an approach to clients and to the behavior change that can be summarized through the acronym PACE. You've probably heard PACE before, right? So PACE is partnership, acceptance, compassion, and evocation. Evocation? I always say it wrong. I think I said it right this time. So MI is best viewed when you talk about a partnership as a collaborative relationship. We know this. We know with coaching, it has to have that common safe space relationship. That's the only way it's going to work. Talk about acceptance. Doesn't necessarily mean you have to accept everything they do or everything they say. It doesn't mean that necessarily. It means you accept them as a person. You accept what they bring to you. They may be making some bad choices and you see it writing on the wall, but that's not for you to take and judge. Talk about compassion. I believe compassion is probably one of the center stage, that with empathy really takes center stage as a coach. And then evocation is the idea that the client has inherent wisdom, strength, and motivation to change. They may not be shown it all the time, but the major takeaway there is that they do have that. And remember, everybody that comes to you for coaching is not necessarily ready to be coached. So keep that in mind as you go through these and just see if that's the case. All right, then we're going to talk about processes. And with processes, we talk about engaging, focusing, and evoking and planning. Now that sounds pretty familiar, doesn't it, with coaching? So when you engage, you're engaging in a process which both parties have established that helpful connection. Again, going right back to what we just talked about with the partnership. Focus, you're focusing on what the client came to talk about. You're clarifying the direction you want to take it. You're moving towards the client's goals overall. When we talk about evoke, we're eliciting the client's own motivations for change. Again, not us guiding them to change. Lord have mercy. And then plan, we're developing a commitment to that change, and we're helping them to formulate a specific plan into action, right? So I just went over those apparently before the slide went. So there you go. There it is in writing for you in case you didn't like me talking to you about it. All right. So you see how this works. Engage, focus, evoke, plan. Now tell me something. For any of you that are already coaches out there, how do you see this unfold when you're coaching? Is it helpful? Does it get them engaged? Can this go forward and backwards? Think about that. Those of you that are studying to become coaches, what do you think?
Are you saying can it go backwards or can it go out of order or anything?
Yep. Can this go out of order?
I would think you have to have engagement
Mm-hmm.
before you can do anything.
Oh, 100%. We got to have that relationship established, right? We have to have that trust.
I think it'd be really hard to mix them up. I don't think it could go backwards.
Yeah. Okay.
I don't think so, but I may be wrong.
Engage, focus, evoke, plan. What happens if I did miss something? What do I do as a coach? What if I engage and then I say, well, let's just start planning? What do you think is going to happen?
Not gonna be bought in.
That's for the client. I'm sorry.
No, go ahead.
I actively coach and I'm already board certified, but I have seen clients, the biggest thing that I focus on initially is that trust and rapport and make sure that we build that foundation first. But I do go backwards and forwards with one of my clients in particular. We have to go back to that focus area quite frequently to continue to move forward.
Okay.
And if we skip one, then we need to recalibrate. It doesn't work.
There you go. Absolutely. Yeah. So it can go forward and backwards, but like Kimberly just mentioned, sometimes it's necessary to move forward. So we've talked about, Jennifer, this is a good example. We've talked about, remember in our stages, where we had phase 1, 2, 3, 4 of coaching, right? And we've taught you guys how to, in the first stage, what is it you're doing?
You're just kind of getting to know each other.
Yeah. You're building that rapport, right? You're asking them those open-ended questions, reflecting things back to them so they hear their own words. You're really engaging with them to truly understand what it is that they want and need, but you're also gaining trust from them. You're really connecting with one another and making that or building that rapport as a coach. When we talk about focus, remember stage 2 and 3, when we start to kind of narrow in on their goals and their action steps? This is where that focus comes into play. And remember when we did those check-ins and we're like, hey, how's that going with your action step? And I could come back and say, man, I thought I could read every night and get a chapter in so I could study for whatever, but it's just not working out. That's when we go back and we have to refocus, right? We go back and start to kind of establish, is that a goal that we really want to hit? If it is, what's more achievable? What's a bite-sized little piece of that could help us move forward? So a lot like Kimberly just mentioned, it's dependent on the situation and it's dependent on the client. But overall, when you take a look at this just very basic idea of the process of motivational interviewing, it goes hand in hand with those stages of coaching. And it's okay to go backwards sometimes and reassess, replan. All right. So I told you I'm going to break those down into my little brain can only handle so much between 6 and 9 p.m. I don't know about you guys, but all right. So when we talk about processes, it's important that we mention the guiding principles. So guiding principles can be put into the acronym RULE. And here it is for you. RULE is resist the writing reflex, understand, listen, and empower. So resisting the writing reflex is probably the most difficult. This is where like providers and people in general, they want, or an expert in general wants to provide a solution, right? This can almost be a selfish tactic for some people, especially if you're a provider and you really just want somebody to do something. You're like, let me just fix this for you. Just get out of the way. Just let me do it. We'll get it taken care of. You'll be good as new. But as a coach, we don't really want that option, to be honest with you, but we don't have that option. We're not there to fix anything, right? So we have to remember to resist that temptation sometimes. We may ask a question that we know the answer to with our client, and maybe they just can't get there. They're just not ready to answer that question. It's not for us to answer for them. Okay. Obviously, understanding and listening, those go hand in hand. And then empowering just goes back to that strength-based approach. Man, I'm telling you what, if you want like all the marbles in one little jar, empower, strength-based, strength-based, strength-based. You're good to go as a coach with those. Okay, so rolling with resistance. Don't wrestle people. That's what that picture is about to show you. Actually, let me move it over for you. There you go. Don't wrestle. You're going to reflect people's words back. One, because they don't necessarily always, know exactly how things are coming out until they hear it back. I can say that because it's happened to me before. I have said something to a coach because yes, coaches sometimes need to be coached. Actually, I highly recommend that. And while being coached, it was reflected back to me and I thought, man, that's not really what I wanted that to mean at all, but I bet that's how that came out, right? Reflect, reframe it, recognize what the client truly wants. Are they saying something because they really want it? Or are they saying something because they think that's what you want to hear? Reinforce personal control and the choice, and refocus. And I'll be daggum, just come back along with them. You are literally there side by side just to walk the journey with them, not to lead them by any means or fix. Okay, so those are your guiding principles within that process, right? Holy moly, we're at the MI skills now. This is where it gets good, and we talk about some ORs. Who here's heard of ORs before? I bet some of you that are already coaches do know what that one is. All right, so with motivational interviewing, here's your skills. Open-ended questions. Oh my gosh, it is like we've already trained you ahead of time with your coaching skills. We got those open-ended questions left and right. You guys know how beneficial those are. Affirmations, recognizing and commenting on clients' particular strengths, their good steps, their intentions, their efforts, and Accentuate the positive. Accentuate. Whew. Okay. So let me ask you something about affirmation. And those of you that have been in this course for the long haul, you know this answer. So don't sit there quietly. I already know you know this. Affirmation. How do we do that? And what are we supposed to do to, or what are we avoiding when we do that with affirmation?
Give any kind of judgments or saying anything that would lead like what they said was good or bad. We're just affirming what they've said succinctly.
Mm-hmm.
Right. We want to
Absolutely.
avoid cheerleading, right?
Yes, sir. Avoid that cheerleading. And why do we avoid cheerleading?
Because it shows like our opinion on it, right? Like, oh, that's so great. That means like we think it's great.
Right.
Is that correct?
Man, Mark, killing it. That's right. I
Okay.
love this. I love when I get to go out for COVID for a few weeks and I come back and you guys are like geniuses. Like, I don't even have to teach anymore. You guys know it. Absolutely. Cheerleading is what we don't want. And we don't want it because we don't want them doing something because they think we like it, right? We want them to do it for them. Absolutely. Great job. Great job, Jennifer and Mark. Reflective listening. Make a guess about the client's meaning, allow for the clarification, and allow the client to hear their thoughts and feelings and ponder them. What are maybe some good skills we already know on this one?
Parroting.
Oh, go ahead.
Parroting.
Parroting, absolutely.
Emotional reflections.
Absolutely. Those nonverbal emotional reflections, right? If there's something that they're kind of lean in, mirror them, right? We already know active listening is a big part of this. We know just about any reflection, complex or simple reflections are going to be a big part of that, right? What about the giving them space to ponder? Y'all remember what I call that?
Silence. Quiet.
Oh, silence, yeah. I like to call it the bubble. You guys remember that? I don't remember if I taught it that night or not. So I have this thing in my head when I'm with clients and they need a little bit of time to just sit with something, especially if it's something they just said and it's pretty powerful stuff. I like to pretend there's a bubble building up and I'm not going to interrupt until that bubble busts. It may bust because I end up talking, but I'm going to give it a minute for that bubble to blow up. And most of the time, those people have enough time to gather their thoughts, to think about what they just said, and they build on it. They do a lot of their own self-reflection through that time. So just be, don't know what I was about to say, but just remember that that time is important. That pause, right? That power of the pause is so important. We don't have to jump in and do question after question after question, reflect after reflect after reflect. Give them that space too. And then summaries, those are a big part of your reflections in general. So like I said, none of this is really new information to you guys, right? We've already taught you these skills through this course. But when you think about motivational interviewing, it's all wrapped up into this really pretty package. Thus, the oars. Okay, so move this little screen out of my way here. Talking about elicit, provide, elicit. We remember those, right? We're solid. We're like professionals over here with elicit, provide, elicit. So this can be used during motivational interviewing. When the client maybe gets stuck and they need a little bit of information, maybe they've even gotten some misinformation, we can throw in some elicit, provide, elicit. Somebody tell me what that is. Remind me. And by the way, elicit, provide, elicit at the board level has changed. I need to get that for you, but we need to change our slides. They've changed it to something else, I believe. EPE, what's that stand for? I mean, what's that mean? Let's provide a listener.
Are you asking like, would you be asking the individual like, what they want to know, or like, what do they know already about it? I don't know.
Yes, sir. It's asking
Oh,
that
okay.
initial question.
Okay, cool.
Say with confidence, Mark. Come on. No, I'm just kidding.
Yeah, that's good.
You
There
got
we go.
this. That's right. You got this. That's right. It's asking them, what do you already know about it? Would you like some information on it? Provide, give them. How much of a provide do you give them? How much information do you give? Do you remember? It's a good little refresher tonight. We're throwing all this stuff in. Do you want to talk for 20 minutes on what you know about something? If you say yes, I'm going to need you to stay after class. No, I'm just kidding. You want to give a very succinct, informative, whatever the case is, information. Maybe even give them resources where they take initiative and go find it themselves. There's a lot of help in that. And then that last elicit is that information that might be useful for you. What do you think you could do with this? Do you feel like you could go look this up? Anything, right? Follow up with that EPE. And why do we do that last elicit? Is to keep the client center of their care, or the center of that coaching session. It's not about what you think. All right, moving right on through this motivational interviewing. So let's talk about some change talk. All right, so with change talk, listening for this kind of language, it definitely helps as a coach. It gives you a very good sense of where the client is and their commitment to truly making that change. It can be reflected to a client prior to identifying their action steps as well. It may help when you're reflecting this to give them that idea so that they're like, maybe I'm not as ready for this change as I thought I was. Maybe we need to take a few steps back and really reassess, right? Or, I'm ready to roll. I'm excited. Let's do it. So the acronym for this is DARN for that change talk. Darn is desires. I want, I wish. This is the stuff you're listening for. Ability. I can. Maybe I have, or I'm good at. R is reason. If I can, then I can, right? And then the need. I have to. This is where maybe some of those barriers we were talking about earlier have kind of peaked. Oh my gosh, my glucose levels are crazy high. I have to do something about it, right? So those are the kind of things you're listening for. All right. So when we're talking about developing discrepancy, we're talking about minding that gap. This is when you hear a conflict from a client. So I want to, but I don't have do. This is where I have to use those motivational videos or listen to a podcast or something that gets me going, right? I have to work out today, but it's 4 a.m. and I hate the mornings and coffee is my friend. I'd rather just drink coffee, right? You have to figure out where those barriers, where those gaps are going to start to hit, and go ahead and start thinking about how you're going to address that with your client. This is where that rapport comes in, and you truly know what it is that makes them excited or gets them excited. Sometimes this may be a reflection of what you heard in the change talk. So partnered against the excuses or justifications for not changing. So again, that active listening comes into play every single time. Pay attention to those keys. All right, so now we're going to talk about the commitment. This is where we hit CAT. All right, so CAT, for commitment is commitment, activation, and taking the steps. So we all know, whether you already coach or whether you're becoming a coach, we all know that where it really matters is taking those goals and creating those action steps and actually following through with action steps. That's where coaching really is like, that's the bang for your buck, right? So, this is going to be your stage 3, I believe. Actually, yeah, stage 3 is where we started taking those goals and making action steps. So those of you that have broken those stages down into 4 different stages in this course, that's where this comes into play. Now, somebody comes back and says, I had trouble with this. What do we do? What do we do if they struggled with that action step they set for that week? We just keep moving forward and say, you'll get it next time. What else you want to talk about?
Wouldn't we reassess the goal to see if maybe it wasn't realistic, or like with the time, or maybe it wasn't specific, things like that?
100%. Maybe it wasn't specific enough. Maybe we needed to break it down. You said you wanted to walk every morning. That's awesome. But we didn't get specific enough to talk about maybe the stuff you need to walk. Do you even have a pair of tennis shoes? No? Oh, wow. Maybe we should address that, right? So it's just the small things, just making sure we go back and address those barriers. As a coach, how can we avoid that?
I would say just going in depth with the SMART goals, the long-term and the short-term goals.
There it is. SMART goals. Almost.
Oh, sorry.
No, go ahead.
No, and just always putting it back to like the values or the mission and the aspiration and purpose, so that way they can give you something very detailed.
Exactly right. Remember those SMART goals, right? I almost started singing RESPECT, but using SMART. So I'm glad you jumped in there, Armando, before that happened, because I could see myself backtracking on that. Yes, SMART goals. Something else to think about. There's a question we could easily use after creating action steps and goals with people. You remember what that is? What barriers do you think may come up this week? Oh, money, right? Something so simple, but it makes them think about it. And they're like, oh yeah, well, if it rains, I guess I can't go outside and walk every morning. Oh, what's a good contingency plan for that? Right? We can avoid that ahead of time. So, CAT, commitment, activation, taking those steps. So looking at the framework of motivational interviewing, do you see how that pretty much just outlined your entire coaching? Those of you that have been in this course, your coaching career so far. Everything that you've learned in this coaching course so far has literally lined up to this, right? This is how we get into that motivation that truly changes, that helps people want to make that change, right? So here's your key points. MI emphasizes a client-centered approach. If you learn nothing else tonight, walk away with everything is client-centered, every time, every way. Collaborative and non-judgmental, focused on clients' goals, enhances clients' intrinsic motivation. Whew, these are big words tonight. Sorry. I think I still have COVID brain. I'm just going to give it that. Overall style of MI is guiding. You're not leading. You're evoking that which is already present, not installing what is missing or not fixing. Ambivalence is normal, part of preparing for change, and a place where a person can remain stuck for some time. I want you to think about that one too. As a coach, people may get stuck, and they may be stuck for a hot second, and that is okay. We still remain non-judgmental. We still ask them those questions. Why did you want this? Why do you want to focus on this? Is this something you want to continue to focus on? Is there something else you want to talk about first and maybe build up to that, right? Questions. And I forgot to watch the chats again. Sorry, guys. I'll check those. I get so excited. No more than 30 seconds. Okay, so that EPE, no more than 30 seconds. I like that. Yeah, I like to keep mine short, sweet. I like to keep it under a minute if possible. Or short. All right. So any questions on motivational interviewing? Any questions on any of the theories or models that we've talked about tonight?
I have a question for those of us that do want to take the exam and be certified. Will we have access to all of the things that the slides and everything so we can study?
Yes, ma'am.
Okay.
We will make sure you have all the access to the slides as well as the YouTube channel for all of these recordings so that you can go back and review anytime you want to. And before you leave this course, by the end of all this, we are going to have 1 week where we really focus on going through everything and making sure we tell you like which book to kind of make sure you're looking at and reading, like The Psychology of Coaching. Read it front to back. That thing's full of good information. And when I took the test, however many years ago I took the test, I don't even remember now, 4 years ago, that everything in that book was just like money for the test. It was perfect. As well as the motivational interviewing book. They really help. But we'll make sure we'll go.
Great, thank you.
Yeah, absolutely. We'll go through the we usually pull up the board's website. We'll show you how to kind of go through their website as well. Make sure you know where their resources are. They give you a good idea of what to expect on the test. So we'll go through that and talk through all that. When I tell you, Jennifer, we have a 93% pass rate for our people that we send to take this test. We take that to heart. We want to make sure you're ready to roll. And we want to make sure that you feel good about coaching.
Great, thanks.
We got you. All right. Any other questions, concerns, comments? We sped through that, didn't we? All right. Well, we ended a little early tonight. You get 15 minutes of your life back. Those of you that are getting your CEs, I will make sure to follow up with you through email and we'll get you your certificate. Make sure that you get what you need. I hope it was a good, thanks. Awesome. Good content. I like that. I hope that was a good reminder for the things that you probably already knew and helps you as you keep moving forward. Let me know if anybody needs anything from me between now and then. Oh, those of you that are here for your CEs, also, you will get a link to this recording so you can always go back and look at it as well. All right, friends, families, and coworkers. That's what we used to call it at the VA. So you guys have a great night. Please let me know if you need anything in the meantime before I see you next week, and have a fantastic night. Bye, everybody.
Haley.
Bye, Armando.
Hold on, no.
Oh.
No, just a quick thing. Two things. The recordings, I've been sending them to Todd, but I haven't. It's been a while now, so I wasn't sure if I should. I've been emailing him, but he hasn't answered, so I didn't know. And I want to be like the asshole to be like.
No, you're good. I think the last couple of weeks we all got slammed. But
yeah, I figured.
This week we're gonna, or actually next week, we're all gonna sit down and kind of catch back up and make sure that we're getting on track. So let me know if you don't hear. Well, let me stop.